Yes, ma'am.
All right. So if you've read and understood considering its surgical pathology station, please tell me what are the differential diagnoses you'll consider for this case?
The differential diagnosis could be osteomyelitis,
Yes, and
osteomyelitis, and gout, pseudo gout.
all right. Okay. Would you be able to tell me the pathogenesis behind osteomyelitis?
Osteomyelitis can occur due to uh, due to due to multiple reasons. And
What is the most common organism?
the most common organism is Staphylococcus aureus.
Yes. Please tell me the pathogenesis, how these organisms cause the disease process.
The terminal metaphyseal arteries make a loop, make loops at the growth plate, and then enter into the afferent afferent sinusoids of veins. There is a stasis of blood and turbulence. This predisposes to the bacterial seeding. Moreover, the lining cells also have a little or no capacity for phagocytosis. It further makes a basin for bacterial seeding, and it leads to formation of developing of osteomyelitis phenomena.
Yes, but these loops are located where about? Where exactly would anyone be able to find them?
These loops are located at the growth plate.
Yes, where exactly is located the growth plate? With
Sorry.
epiphysis, with the metaphysis, or where exactly? So these are the metaphyseal arteries which forms the loop.
Yes, these loops are between epiphyses at the junction of
Yes.
the metaphysis and epiphysis.
But then again, remember, osteomyelitis was caused by the organisms, right? How these microorganisms or these organisms invade or cause infection, how acute inflammation takes place. That is day one. So, what happens? If you could just walk me through the process, if you could tell me what is involucrum, that is day
Involic
14, right? So, first 14 days, we couldn't recall them. We couldn't get through them. Day
All
two
right.
is suppression, if you could tell me, and day seven is sequestration. And then day 14. And what is sequestration, if you could define the term?
Sequestration.
Yes, please.
Sequestration is a dead
Mhm.
or
Good. Good. Dead
fertilized
bone. Yes.
segment of
How the death of the bone takes place?
the
By
death of the
which
bone.
process?
The death of the bone takes place due to a necrotic process of
Very good.
uh, myelitis.
Yes. What are the different types of necrosis you can recall and tell me about?
There are few types of necrosis. For example, coagulative necrosis, which can occur into any organ except brain. There is a liquefactive necrosis, which occurs in brain. There is a Moreover, there is a gangrenous necrosis, which can be wet or dry.
Okay. Can you give me one or two examples of onchosis necrosis?
Onchosis necrosis.
It could be extrinsic apoptosis and intrinsic apoptosis. It could be both of these.
All right.
Yes. Would you be able to give any example of extrinsic or intrinsic apoptosis? Or what is apoptosis? If you can help me define.
Apoptosis is unlimited or excessive growth of excessive differentiation of cell
Yes.
or limited growth of the cell.
Can you would you be able to tell me how these organisms penetrate or cause the formation of osteomyelitis? Actually, I want you to tell me the mode of spread or the mode of causation of osteomyelitis.
Basically, there is this blood flow becomes slow and turbulence. This causes seeding of bacteria.
Yes. Other than
Uh,
blood, is there any other way of communication or spread? Basically, this is what I want you to tell me.
this spread can be exogenous or through the blood. Exogenous can be due to open fracture or excessive bone exposure in a surgery.
Okay.
Hematogenous spread can be due to sepsis.
Yes, through bloodstream. So basically, there are three ways. One is blood. What are the other two? If you could recall and tell me.
Uh, I will answer
One
the
is
question.
trauma, other than blood, direct. Okay. Third is contagious from the local or surrounding areas.
Yes,
Yes.
contagious.
And these are
Yes,
the three. Right. What happens if one fails to manage the patient with infection or bony infection? What can happen? This can result into chronic infection. And what are the complications of this chronic inflammation?
chronic osteomyelitis can be can result into bony fracture or formation of a sinus, and which can lead to prolonged.
Bony fracture. Are you trying to say pathological fractures?
Yes,
Okay.
pathological.
Come one step little earlier. How this pathological fractures takes place, or these fractures,
Pathological
pathological or without any trauma, the fractures, how do they take place or how do they occur?
pathological fractures occur due to the due to a process which is called osteoporosis.
Yes, that occurs because why? A
Because of
person has been given steroids, but here, before that, why would we need to give steroids to the patient in this scenario? Okay,
to se-
chronic
to se-
infection. Okay, please listen. Chronic inflammation leads to the formation of squamous cell carcinoma. Okay, so this squamous cell carcinoma results into what? This is the complication, right? One has failed to cure the management. Here, the history is patient has a plate, knee plate, which was
yes,
there. So this is the foci. One has to remove it. If we will not remove it, all right, you said sinus will be formed, but because of this sinus, it will get inflamed, of course. And if we do not still do anything or we could not manage it, it will result into squamous cell carcinoma formation
yes.
because of chronic irritation. So how should one treat the patient with osteomyelitis?
Osteomyelitis should be treated with high dose of intravenous antibiotics, and before giving intravenous antibiotics, we do culture and sensitivity of the pus,
Yes.
and the intravenous antibiotics against Staphylococcus aureus, Streptococci, and gram-negative rods such as Escherichia coli. Uh, the high doses of intravenous antibiotics are commenced against
Yes.
these. Yeah.
And there
Uh,
could be sportive medications like for pain and pain management and dehydration. You
and
could
dehydration
even
and age.
offer splintage of the limb, and there could even be surgical drainage
Surgical
if
drainage, the
bone does
antibiotic
not respond to the
to
antibiotics.
the antibiotics is 2 days.
Right. Please tell me how or why pus bursts through the bone, or by which process?
Due to the raised intraosseous pressure and increased osmolarity,
Yes.
due to breakdown of cells
Yes.
and formation of large round cloacal openings in the involucrum.
Yes.
So the pus escapes through these openings into the surrounding tissue
Yes.
and spreads to the skin
Yes.
through
Through
through formation of
hematogenesis.
thread.
Yes. Yes. Good. Thank you.
Thank you.